The jaw thrust. The jaw thrust maneuver is used for a patient with trauma who is unconscious or too drowsy to protect their own airway. When there is concern for cervical spine injury, the jaw thrust opens the airway while keeping the neck still. After doing the jaw thrust, place a cervical collar to keep the neck immobilized. Using gloves and mask, position yourself at the top of the head. Place your fingers behind the angles of the lower jawbone on both sides. Move the jaw upward while keeping the neck straight. This pushes the lower teeth upwards. When moving the jaw upward, imagine a line pulling the jaw directly up to the ceiling. The neck should not move. Look inside the mouth and gently remove any visible object. The maneuver is the same in a child. Place your fingers behind the angles of the lower jaw bones. Your thumbs can rest on the cheeks. Move the jaw up while keeping the neck straight. Hold the jaw in place to keep the airway open. Do not let the jaw drop back because this will close the airway. Remember, place your fingers behind the angles of the lower jaw. Move the jaw upward while keeping the neck straight. The neck should not move.